Hello friends, welcome to Medicine of 101. Today we'll just go through the topic from the aspect of pharmacology, the drugs used in pregnancy. Okay, so let's start today's topic. The topic is drugs used in pregnancy. To have the concept regarding this topic, we should know about the first thing that we all know that there is a connection in between the fetus and mother through the placenta. We all know it. Now we need to know that can the drugs go through the placenta? Of course we do. We can have the doubt regarding these questions. So let me clear you this. Let me clear you this doubt. Of course, near about almost we can say almost 99% drugs can cross the placenta except two drugs like the insulin and heparin. So let me write it here that almost 99.9% drugs can cross placenta except the insulin and heparin. Okay, now whenever we are just taking the drugs, in case of the pregnancy, whenever we are just prescribing the drugs, some of the drugs of them, those can have the side effects on the, in case of the ladies or those who are pregnant, of course. So the drugs which can have, which can cause the malformations of the organs of the fetus, those drugs, they do have a bad effects, and that's bad effects causing drugs are called as the teratogenic drugs. Okay, so we need to know also drugs which can cause malformation in the organ. Okay, which can cause, which can cause the malformation of organs. They will be called as the name that is called teratogenic drugs. It's very important worth repeating. Teratogenic drugs. Now the thing is here that this teratogenic effects depend upon that the time duration. That means it may be the first trimester, it may be the second trimesters, and of course along with the dose, how much dose we are giving. Okay, so the effects of the teratogenicity, or you can say the teratogenic effect, teratogenic effects depends upon two things basically. One is like the time or duration of the trimester, and along with the dose. Okay, the frequency of the drug we are giving, the dose of a drug. Okay, now we need to know that in first trimesters. Okay, in first trimesters there is like gross congenital malformation. Okay, whenever the teratogenic effects will be there in first trimester, if the drugs are just being used in first trimesters, teratogenic drugs, then there is a chance to have the gross congenital malformation. Okay, gross congenital malformation, of course. Okay, now we'll just discuss different drugs or different type of the disorders in pregnancy. Okay, now first we'll talk about the antihypertension. So antihypertension. Now during hypertension, which types of the drugs are safe in case of pregnancy, which are not? We need to know these things also. Now the safest drug, we can say the safest drug of hypertension during pregnancy is labetalol. Okay, this is the labetalol. Of course, along with the labetalol, we are having one more drug, that is methyl dopa. You can also use, but the drug of choice, you should say the labetalol. The methyl dopa also we can use out here. Okay. Now, what are the contraindicators, or which type of the drugs we cannot use during the pregnancy? So now we have to know also these things. That's the you know ACE inhibitor and like aldosterone receptor blockers. This two types of the drugs, okay, we cannot use because these are the contraindicators. Okay, these are the contraindicators, like the you know and these two types of drugs, if you use, then maybe there's some problem within the diabetes of the pregnant males. Angiotensin converting enzyme inhibitor and the aldosterone receptor blocker you cannot use because these are the contraindicators during the pregnancy in case of the hypertension. Okay. Now we'll talk about the antithyroid drugs. This is also important. Now there are basically two types of the drugs. One is PTU, another is carbamazole. Okay. Now there is the two drugs having the individually like two different features. We need to know these things. First of all, we will talk about the PTU. There is a very less chance to cross the placenta for the PTU. So cross placenta very less. PTU. Okay. Now PTU stands for propyl thiouracil. I am repeating again, propyl thiouracil. Okay. Now the drug of choice. This drug of PTU is the drug of choice in first trimester. So, okay, we can use that PTU in first trimester. First drug of choice in first trimester. Okay. Now the main problem is here that this PTU, it's the dose of the PTU, it's like we have to give near about 3 times in a day. Okay, so which can cause the liver damage. This is the on top of the side effects we can say. The side effect is like this. Should be given 3 times. Should be given 3 times in a day, and that can cause that can lead to the liver damage. So a little bit problem out here. Okay. Now if we talk about the carbimazole, and it's the most safest drug in case of the second or third trimester. Okay. Second and third trimester. Now if the question is asked like this, which of the following, like the antithyroid drugs are good for the pregnancy or drug of choice, then we will simply say the PTU. Okay, if it is normally asked. Okay. Now these two are the drugs of choice in case of the antithyroid drugs. Okay. Now we'll talk about the anti-epileptic drugs. It's also important. Anti-epileptic or anti-seizures. Actually, the problem is here that almost all epileptic drugs are teratogenic. That means what? They are having the bad effects or side effects or contraindicators in case of the pregnancy. So we can say that almost all drugs are teratogenic out here. Okay. Now out of them, some drugs are less teratogenic and some drugs are more teratogenic. So you have to know. So the highest teratogenic amongst the anti-epileptic drugs. This is we are having valproate, and their lowest teratogenic. There are some drugs they are having the lowest teratogenic effect. The two basically. So you have to know their name. First one is levetiracetam, and the another is lamotrigine and levetiracetam. Okay, these two type of the drugs we can use in case of the anti-epilepsy. Okay. Now the problem is here, these anti-epileptic drugs, they are having a problem, the side effect, they can cause the neural tube defect. That means whenever there is like the neural tube formation, at that time we'll know it, that's like these things within the neural tube there can be something like the hole, and by these things some like the alpha amino protein something can be like leaked out, so there is a problem. So just to sort out the problem, we need to give also there is like the folic acid, okay, to just fulfill the neural tube defect. Folic acid, we have to give of course high dose of folic acid. We need to supply or we need to prescribe them also high dose of folic acid, as they are having the side effect, what the side effect of the neural tube effect, okay, neural tube malformation may be there or defect, whatever you can say. Okay, there are also some drugs which are also like the contraindicators, or those are not also useful. I'm not mentioning out here. In the next subsequent videos we'll talk about those things. Okay, now there are some drugs, we can say antimicrobial drugs. Okay, now, antimicrobial drugs used in pregnancy. Those drugs are basically the penicillin. They are also like these things, we can say cephalosporin, and we are having macrolides. Okay, now we do have also some like this, like type of the drugs we will just discuss about the next subsequent videos. Okay, thank you for watching, guys.